Good morning, everyone. This is Dr. Young Zhu of Feet and Beyond in Hackettstown, New Jersey. Today, we're going to give you a behind-the-scenes look on what goes on in a day, the morning of helping a patient with minimally invasive surgery. We want to align our vision of what the patient's foot wants to look like with what the patient needs their foot to look like, as well as how it functions. That's the beyond part of Feet and Beyond. We not only want to see a problem and fix it for the patient. The first step is finding out what the patient's needs are. What do their feet need to look like when we're done with them? What kind of function does it need to be? Here at Feet and Beyond, we use minimally invasive foot and ankle surgical approach to help patients. Minimally invasive surgery done by Dr. Nguyen uses no metal, done right here at our office. Patients walk out on the same day because we only use local anesthesia. That is the safest and most innovative technique available at this point. This morning's patient has had a hammer toe for many years. It's been hurting him for many years. But today, we're gonna make a difference in this person's life. Give them a pain-free foot, straighten out their claw toe, and as well as helping them to return to the quality of life that they want. So as we do a walkthrough today, we have many patients ask us, and potential patients that ask us, what exactly happens at Feet and Beyond? So let me show you. This is our office. And let's see what the surgeon is up to about an hour before surgery.
Sale to all the different aspects of it, so that would be a good resource.
Dr. Nguyen is currently in a meeting right now. She will go over the plans in just a little bit regarding how she's going to help this patient. Many patients also ask us, what is our technique? How this can be accomplished right here at our office? And many wonder, what special equipment do we have? Well, we have a surgical suite. All right, let's go back and revisit with our surgeon this morning, who's done with her meeting. Now she's gonna be pinpoint focused on taking care of her patient this morning. Our patient, like I said before, is having a severe contracted hammer toe. Today is going to be the first day that we're going to make a difference in this patient's life. So now that Dr. Nguyen is done with her meeting in the morning, let's hear what her game plan is this morning.
It's going to be a great day because every day that I be able to transform or helping the patient to walk better, to be a better version of themselves through good foot health is a good day. So this morning going to be the gentlemen who've been suffer with very severe contracted hammer toe. So if anybody who don't know about hammer toe, is the toe is bending this way. And the way that is how his toe got bending is every time he walked, every step he made, it create a huge pressure on the tip of the toe that creating the lesion, what we call callus or painful. Sometimes it break down to blister, and it create an open sore, which is an open of the skin, debilitate him from walking and be active. So now today is the day that he's gonna have this condition corrected, and through our minimal invasive approach, the most innovative way, safest way without hardware, patient be able to have this procedure done in the office through local anesthesia to the toe itself. Patient gonna be awake and be able to walk out with immediate transformation from bending toe to straighter toe. Stay tuned.
This hammer toe has been, think of it as being on the offensive, causing pain, agony to this patient. Here at Feet and Beyond, we alleviate patients' misery due to their foot pain with the most effective, safest, and innovative technique available. We help them to be a better version of themselves by taking away their foot pain and returning them to the quality of life that they want to have. Alright, now that we heard from the surgeon, let's look at the gear that she will have to help her take care of our patients today. Alright, what do you feel now? You're still awake, obviously, right?
Yeah.
Yeah,
It just
okay,
feels
good.
cold.
That's
Cold.
right, okay. No really discomfort or pain, correct?
No.
Good. Alright. So, the needle is actually in your toe right now, which you just feel cold, which is normal, alright?
Yeah.
That's what Novocaine does, it goes numb very fast. So, alright. And all of that pressure that you're feeling, all the anesthetic that's going in, so that's all normal too. We're just draping your foot now, Charlie, okay?
Yeah.
And you know how this goes. We're going to test it, test your toe that got the wind numbed up. And we want to make sure it's completely numb before we begin. How do you feel now?
Good.
Good. Alright, so we use this fluoroscope as the doc's eyes and ears to look at
Yeah.
the internal structures. Okay? Here's your second toe right here.
Yeah.
You see how the third toe has 3 bones? 1, 2, and 3?
Yeah.
You don't see it here. It doesn't mean it's gone. It just means that instead of doing this, it's doing this.
Yeah. Yeah.
It's pointing down. So when we finish, we want to see 3 bones here.
Gotcha.
Okay? So that's what we want. So this is the second toe. Dr. Nguyen's going to mark the area. You can see it follow it along
Yeah.
the screen right there.
Yeah.
Dr. Nguyen going to do what we call landmarks. Where she going to make that one poke.
See, afterward your toe gonna be straight like this.
Yeah. Okay.
So that would be.
See where the third bone is? It all of a sudden pop out of its joint. Pop in, I mean. It's been about 5 minutes since we numb up your toe. How do you feel right now what Dr. Nguyen is doing?
Fine.
Good. What do you feel?
Any
Don't feel
pain at all?
Okay. That's the testing device. So it tests you how the anesthetic is doing.
How about the bottom? Any pain?
No.
Good.
Good. Alright, Dr. Nguyen made that little poke incision and she's freeing up all the soft tissue there. Okay? You should feel a little moving, that's all, right?
Yeah. I feel the toe like going up and down.
Up and down.
Okay. Any pain or discomfort?
No.
Good. So that's gonna be for another couple of minutes, alright? Just to kind of let you know what's going on down here. Okay, now after Dr. Nguyen is done with the top of the toe to release all that soft tissue there, now she's on the bottom of the toe doing the same thing. That is to get inside that joint right there to kind of release that joint. Now you already see 3 bones in your toe. 1, 2, and 3.
Yeah.
Yep, it's all lined up. All right, see that? How the joint kind of get freed up? See that?
Yeah.
Just a little by little. Okay, and just in case you're wondering, there's just a tiniest bit of bleeding down here, which is normal.
Yeah.
Think of it as like a paper cut, that amount of bleeding down here
Yeah.
from those 2 little poke incisions. And just by releasing the soft tissue, the toe is already pointing straight already now.
Yeah.
Now Dr. Nguyen's going to make that little incision in the bone, realign the toe, and let it heal organically and let it heal itself.
Yeah.
And unlike your previous procedures, there's not going to be any metals or anything on your inside your foot. No pins, no screws. Just imagine if they had this technology, how your foot would be different.
Oh, yeah. Are you kidding me?
Yeah, right?
Yes. To be able to do this in an office with no screw or plates.
Yeah.
Local anesthesia, you're gonna walk out of here in about 20 minutes.
Yeah.
Yeah, the second toe is usually, it takes the brunt of all the lesser toe and the pressure.
Oh.
And it's usually the second toe most of the time are the longest.
Alright, so this is almost done. So you see 1, 2, 3 bones now,
Yeah.
where in the beginning you didn't see this bone at all
No.
because it was hiding like this.
Yeah.
And you're looking at it from top to bottom. One little poke incision right there, no bleeding. And the toe is straight and aligned with the other toes. Alright, Charlie, if you could relax your foot for me, for the doc, so she could strap the toe in a straight position to heal. And
Like that.
yes, please, yes, thank you,
Okay.
yes. Do
I
we
know
need
I
a
was-
stitch,
I was
Dr. Nguyen?
bending.
No stitch needed, look at that. Alright. Alright, so Dr. Nguyen is just strapping down the toe now, so just using tape and medical bandaging to calm the swelling down. Alright. And that's how it's going to heal. So this bandage stays on for a week, allow the body to heal,
Yeah.
and then it's removed and re-strapped down with a lesser dressing a week from now.
Yeah.
And total strapping down time is about 2 to 3 weeks or so, depending on how the body heals and how swollen it is.
Yeah.
Okay. You're leaving
Yeah.
in regular shoes after toe procedure. How long did it take, Charlie? You looked at the clock.
It was a half an hour.
There you go. Any pain right now?
No.
Good. Awesome.
To find out more about minimally invasive foot treatment, contact Feet and Beyond at 908-576-0880 or visit feetandbeyond.com.